Hello, how are you?
Hi, good. How are you?
My name is David. I'm going to be your nurse today. Um, so this is Mr. Johnny.
Yes. He's a little shy.
Oh, okay, that's
Yeah.
understandable. Um, so you guys are here today for?
We're here for annual checkup.
Oh, excellent,
It's
excellent.
10-year annual checkup.
All right, and how have things been going?
Pretty good. Pretty good. He's very active in sports and doing good in school.
All right, are there any issues he has, like physical issues at all? Health issues?
He just has a history of asthma.
Mm-hmm.
It's pretty well under control. Sometimes he doesn't do things as necessary when he's working out, but we're trying.
Okay, I see he's going from 11 to 12, getting close to those teenage years. Any issues there in his health or with his social aspect with the kids or anything? How about you, Johnny? How do you feel?
Oh, don't be shy.
He doesn't seem to want to talk to me today.
No, he's a little shy.
Okay.
No, he's doing well. He's doing good in school and everything's really good.
All right, excellent. We'll speak further. Let me do an assessment on him. I'm going to start from his head, work to his toes. Cool little head to toe assessment here.
Okay.
Johnny, is that cool with you? Okay. Nod your head. Thank you. All right, I'm just going to start. First of all, any pain anywhere, any discomfort? You're not having anything? Okay, good to know, John. I'm going to start by touching your head and scalp. I just want to check and make sure everything's fine here. Okay, can you turn your head for me? Awesome. Turn your head this way. Okay. You having any pain or any discomfort here, Johnny? No? You've been doing fine? All right, good. We're going to take a look inside your ears. I have this little light here. So, let me take a look. Pull it up, down. Okay, looks good. I'm going to turn your head down this way. And I'm going to take a look over here. All right, that's good. I'm going to have you lift your head up and I'm going to look in your nose. Any history of nosebleeds or any type of problems like that, Mom?
No.
Okay. Johnny, I'm going to have you open your mouth all the way and say, looks good. Has he had his tonsils out? They look a little red.
No, he hasn't.
Okay. Any history of any issues with his tonsils, any infections, multiple infections?
No.
No?
When he was little, but
little?
he's been okay for the last 5 years.
Okay, good. Let's see. His glands seem quite fine here. Johnny, is it okay if we take off his shirt or just expose his chest for a minute?
Yes, that's fine.
Okay, let's do here. Okay. Oh, you're looking good there, Tommy. Johnny, sorry. Everything looks nice and even. Everything looks good. I don't palpate too much. All right. We'll put his shirt down and then we'll come back to this in a minute. First, I want to check how his strength is in his arms and his legs. So squeeze my fingers. Okay, excellent. Okay, bend your elbows up. Very good. Bend them down. Very good. Let's do your feet. Okay, point your toes to your chin. Okay, point your toes down. Now go against me. Excellent. Okay, now lift your legs up off the bed. Good strength. All right. Now, okay, try again. Point your toes down. Okay, good. Gonna bend your knees here. Okay, push against me. Try again. Very good. Okay, push against me. Excellent. Does anything ever hurt? Has he ever complained any like hip pain or any types of pains? Usually around his age, they start going through some growing pains. That's what they call. So sometimes if they have a growth spurt, might have a little bit of aches. That's normal. But if the pain persists for more than a week, please make sure you bring him back in. Okay? All right. So I'm going to go ahead and we're going to do some listening here. First, I'm going to listen to your heart. I want to see how well it sounds. Okay, I'm going to listen. Any history of any cardiac conditions, any murmurs, anything like that?
No.
No. And when he was born fine. No issues in the heart.
No
anything
issues.
else?
No.
All right, next to you. Just going to listen for 1 minute here. Okay, 1 minute. Sounds good. Now I'm just going to listen to all aspects of the heart, just to listen to them. Okay, so here. All his valves in his heart sound really good. I don't hear any murmurs. Okay, that's always good. Now I'm going to take a quick listen to your heart and your lungs. Okay. first I'm listening to the front, then I'm listening to the back. I prefer. Take some deep breaths for me. Okay, we got a nice even rise and fall. Okay, now I'm gonna sit you up, honey. Oh, thank you so much. I'm gonna lift your shirt up here. Listen to the top here. Take a deep breath. Excellent. Take a deep breath. Very good. Again. Very good. Again. Good. Again. Good. Okay, let's lay you back. Just gonna listen really quick here. Just get a good listen from the back. Deep breath and good. Deep breath and excellent. Alright, I know I'm having you breathe a lot. If you're having any issues, you let me know, okay, Johnny? Alright, I'm gonna lay you flat really quick. You tell me if you're comfortable. Okay, that's about as far down I want to go.
Don't fall asleep, Johnny.
Okay. I want you to take a deep breath for me. Alright, good. Another deep breath. Okay. So we're seeing a good even rise and fall of his chest wall with good spacing. Thank you so much, Johnny. I'm gonna keep you flat there because I'm gonna listen to your belly next, okay? So I don't hear anything with his lungs. I know he's been doing his asthma, so it sounds good right now. Are there any issues recently? Anything going on? He's been following up his regimen.
Yeah, I mean, sometimes he forgets to take it to school. We only have one inhaler. My only concern is winter's coming, so that's when his asthma flares up.
Okay.
But he's been good in the summertime.
Okay, so I want to make sure that we take a look at that. I'm going to go more in depth on the lungs towards the end. I want to really focus in on that.
Okay.
But I'm just going to finish everything else and we'll come back to that.
Okay.
Before I go on, Johnny, I do want to take a look inside your eyeballs. So I want you to open your eyes for me. Excellent. Shining a light here. Okay. Now tell me, there we go. Okay. Try this side. Awesome. Okay, there we have it. That's good. So I'm going to listen to your belly now that we've moved you around a bit. He's eating. He's fine with his eating. And
he eats a lot.
Okay. Take a quick listen. Okay. Okay. His bowel sounds are good. Okay. All right. I'm going to press on your belly now. You tell me if anything hurts. Okay. Okay. Nice and soft. That's good. All right. And going to the bathroom fine. He's voiding fine. Has no problems with number 2. Nothing. Any history of constipation, anything like that.
No.
Okay. Thank you, John. You're doing really good right now. I do want to check your pulses, make sure everything's regular here. So taking a quick look. Feels good. Feels very good. Nice and strong. Nice and equal. Thank you so much. Looks good. Looks good. All right. Johnny, I'm going to tell you a word, and I want you to remember it for me. We're going to go with California Bear, because that's the shirt you're wearing. I'm just going to sit you up, okay, while I'm doing your lung assessment. Just help you up a little bit. Oh, there you go. All right, I'm going to do I want you to go ahead and tell me if anything hurts or if you feel anything weird. I'm going to sit you forward. Thank you. I'm going to tap on your back here. Sounds good. Can you cough for me? Good job. Good job. Okay. I'm going to do a quick set of blood pressure and this. Do your blood pressure here. And no issues with the arms either side of the blood pressure, correct? While I'm doing a blood pressure, I'm going to do what they call a pulse ox. I think you know what that is.
Oh, to measure his oxygen?
Yes, we'll check the oxygen in his blood, okay? Excellent. I wish I had his blood pressure, let me tell you.
Is it good?
It's very good. It's always athletic. So his heart rate's fine. His pulse ox is 100%, which is normal on room air, so that's really good. All right. His legs are moving.
Good.
So,
Is it okay if I excuse myself? I have an important call to
yes, of course, that's
Okay.
fine.
take. And then you can ask him any questions you need to. I'll be right back, Johnny, okay?
Let me put this
All
up
right.
here.
5 minutes is okay? I'll be right back.
Yeah,
Thank
I'm
you.
gonna put this side rail up just in case it's. It's me. How you feeling, Johnny?
I'm good.
Oh, that's good. Oh, you're a little bit more talkative. What happened? You seem a little bit shy. Is anything going on?
No.
No? Okay. How you like school? How
I'm
you like
scared. That's it.
Oh, you're scared?
But you're nice.
Oh, thank you. So what's going on in school? Like, are you in any sports?
Yeah, I play football
Okay.
and I run.
All right. So when you're doing all of that, do you ever have any problems, like for your asthma pump and stuff like that?
Sometimes it's hard to breathe.
Okay. Do you use your pump when you feel like you feel short of breath?
At home?
Yeah, at home, at school, like right before you're playing sports, or even while you're playing sports. Do you try to use it?
I try.
Okay. Can you tell me what's going on? Why wouldn't you want to use it?
It's embarrassing.
Why is it embarrassing?
Because my friends don't have to do it.
Ah, that's understandable. But if you want to play like at your peak game, you got to use your lungs. And to use your lungs 100%, just for now, using that pump will help you out.
Okay.
Do you know how to use it? Have you ever been taught to use it the most effective way?
I can show you how I do it. I think I'm doing it right.
Okay. So before we do a demo on the pump, how about you show me your incentive spirometer? Have you ever done it in a spirometry test?
Yeah, my mom makes me do it every morning.
Okay, that's good. So what we do is, I just want you to blow out as best you can, and we go ahead and do it that way. Remember, we're trying to get between 240 and 250, okay?
Okay.
So, go ahead, ready? 1, 2, 3, flow. Excellent. 250, that's good. Now, what happens if you have to go under 240?
I don't know.
Okay. So if it's under 240, that means we should look at maybe you're having some problems trying to breathe evenly and effectively, okay?
Okay.
So usually with that, we want to kind of take one puff. Now, do you use the spacer or do you just use the puff?
I use the blue thing.
The blue thing? Excellent. That's actually one of the best ways to do it, okay? So you know how to put everything together here?
Yep.
Okay. Do you shake the medicine?
Yep.
And then what do you do next?
I put it on the blue thing.
Okay.
I take the little cap off.
Okay.
And then I let a big breath out.
Okay.
Take a big breath in and I press down on the medicine.
Okay. So you press on the medicine first, so it's in the spacer in here, the medicine's in here, and then you take a deep breath in with the medicine, correct?
Oh, okay.
Okay, so you want to make sure that you're breathing in the whole medicine. So you're going to take a deep breath, you're going to breathe out, and then you're going to spray this medicine in here, and then you're going to take a deep breath in from the medicine in here, okay?
Okay.
It's going to work really well for you, okay? Now, if you're at school and you're playing a sport, or if you're at practice for football and you feel a little bit shy or bashful about that, because I know sometimes you may be the only kid, you can go and we can talk to your coach, and then when you need to use it, you can run behind the field or go to the bathroom or whatever, and coach will understand why. You can tell them that, I have to take my medicine, and you can do it there so no one sees you, and then you come back out and continue to play and practice, okay?
Okay.
How do you like that?
That sounds better.
Okay. So, do you know what your asthma action plan is?
I know it's bad if it's below 150.
Yes, yes, it is. So we'll wait for your mom to come in here, and then when your mom comes back, we'll sit down and we'll discuss some things for your asthma action plan, okay?
Hello.
Hi, how are you doing? I just had a nice little conversation with your son.
I'm so sorry.
Yes,
Oh, he talked? Oh, wow.
he's very, very talkative when you're not around.
Oh, I see. That's why he doesn't pay attention to me.
I'll drop this so you can
Oh,
next to him.
thank you.
Right.
Okay.
So we were just discussing using the pump and the sinus barometer. He says that you use this every day with him.
Every morning.
Excellent. That's
Yes.
really, really great. This is one of the newer ones, so I'm gonna make sure you take this home with you.
Okay.
It's really compact and easy to use.
Okay.
It's probably similar to the one you have. You know, you can mark the settings, the high and low. So since for his age group, we're looking at 240 to 250, good range. Below, may need one puff. We got to 140, we may need some emergency interventions. Okay, I'm sure you know that. And Johnny seems to understand as well. He also explained to me about the asthma pump.
Mm-hmm.
So he was doing the puffer, but it doesn't seem that he was doing it effectively. He was getting some of it. What happens is when he does the puffer and you put the medicine into the spacer, he was breathing out instead of breathing the medicine in. So he was taking a deep breath in, blowing it out, and then breathing it again. Which the best way to do it would be for him to take a deep breath out and then put this medicine into the spacer and take a deep breath in so it gets into the lungs properly.
Okay, it's been such a long time.
I can imagine. And especially now with winter coming, you're going to want to make sure that he knows how to use this. Okay? So we'll make sure you go home with prescription and we'll get you 2 spacers.
Yes.
I was speaking to him.
He's shy.
Yes, and he doesn't like using it in front of his teammates at school.
Yes, I know.
So maybe we can set up a meeting with his coach.
Mm-hmm.
Maybe come up with a code word or something so that he can tell the coach that will mean that he needs to take his medicine so he can run into the locker room or somewhere private and take his medicine and come back out without any of the kids knowing.
Okay.
That would be something that could help him out. So
Sounds
we'll make sure we give you 2 spacers so you can keep one at home and you can keep one at school.
Perfect.
We also want to make sure the school nurse knows that he has these medications. That way she can help him with that. Okay? So we also want to discuss an asthma action plan.
Mm-hmm.
Okay? I know that he's had one in the past. Can you talk to me about the one he has now?
Well, I know if we do his peak flow and it's below 150, our plan is to give him 2 puffs of the albuterol, and then if he doesn't improve, we take him to the ER.
Okay.
If he's in the yellow zone,
Yes.
so I think it's 150 to 200 to under 240. We give him a treatment, and I, try to make him come here and see you guys, or do it every 6 hours. And then I know his green zone is the 240. Should he be doing this before he works out too?
He should. He should be doing it before he works out.
Oh.
And also like before sport and after sport sometimes.
See, we were only doing it in the morning.
Oh, okay. No, we can do it every time. The things that he does that exacerbates his asthma and makes it worse, we want to track that.
Okay.
So I want to also talk to you about triggers.
Okay.
So in that aspect, I want to talk to you about where do you live? Do you live in a home? Do you live in a condo?
We live in a house.
Okay.
Yeah.
Do you have a backyard?
We do.
And do you have pets?
No. We couldn't.
Okay.
He was very
So
allergic to it as a child.
yeah, so that's one of the things is sometimes with pets, the dander from the dog or the cat that can have effect on his asthma.
That's why we had to stop seeing his auntie.
Oh.
She has 2 cats.
Oh yes.
Yeah.
That's one of the things. Also in the backyard, are there any like grass, pollen, any type of plants that sometimes activate his asthma? Have you noticed?
Yeah, in the springtime.
The pollen.
That pollen is that white thing that falls off the trees. Yeah.
Yes. So that's something we want to make sure we take account for. There is websites, and I'll get the information for you that will tell you the pollen count.
Oh.
So we can judge like what pollen count is having an effect on him having an asthma attack.
Oh.
Okay, so we'll look at that. So that way, when you wake up in the morning, you can check and see if the pollen count is going to be low.
Yeah.
Then you don't have to worry. But if the pollen count is going to be high, just review what he needs to do for his asthma action plan.
Those 3 days in December in South Florida when we get winter, horrible for him.
I can imagine.
Horrible. So That's why I said we need the pump.
So there's
The trigger.
some other things we need to look at as well. We need to look at some we're leaning towards some other non-traditional types of medicines. We're looking at the holistic aspect of it. Have you tried different type of teas?
No.
Well, we can try that, and I know Johnny probably wasn't like tea too much, but we can try some of those.
Okay.
Ginger tea is actually very good, and lavender is actually very good in the olfactory aspect of it. So you can have some ginger tea to help relax the smooth muscles of the lung, and then lavender has a calming effect. So some anxiety can sometimes exacerbate the asthma.
Okay.
So I know sometimes they have those misters they have for the rooms.
Yeah.
You can do those and with a couple drops of lavender oil. When he feels a little bit anxious and feels like the asthma is coming, we could try that to help him relax him.
How about that eucalyptus? I know it's
The
strong.
eucalyptus
It's good
is
for
very
you.
good. They actually make the oils.
Okay.
So he
alright,
can put
good.
just a little bit right here. It actually gets into the airway and helps him breathe.
Okay. Perfect.
Okay, that's
Yeah.
very good. That's some of the things. There's also community resources. So there's community groups because he states that he's kind of, feels a little bit apprehensive about
Teenagers.
about his care with taking care of his asthma. So we can find a group of kids. There's a lot of kids out there that play a lot of sports, and there's a lot of big time sports heroes that have asthma. So they come to these communities. They talk to them about them growing up with asthma. They go play sports together. They do activities together. They even share. They have these new apps that you can have an asthma action plan, and they share the apps with each other, and it's very nice for them. And it helps him feel more comfortable and understand there's other kids out there that have asthma that are active like he is. Okay.
Sounds good.
Excellent, excellent. So I saw when Johnny walked in, he walked nice and even. I didn't see any problems. He seems to be breathing fine. You seem to have a handle on his care, on his asthma. Are there any other medical history that do you want me to take, look at, address any of these issues at all?
No. I just want to know. I know it's flu season. Is it okay for him to get his flu vaccine?
So it is. It is okay for him to get his flu vaccine. It's actually very important for him to get his flu vaccine. It's also important that we follow up with any type of infections. With the weather change, you may get a cold, you may get a cough. That sometimes mixed with the asthma will have him become more of an issue. So with the asthma and his cold or an infection, he may develop some lung issues. So we want to keep an eye on those things.
Okay.
Supposedly this year is supposed to be a very bad flu season.
Mm.
So also are all his immunizations up to date?
Yes, they are.
So that's good. You want to stay on track with the immunizations because without the immunizations, we kind of leave him without a defense against some of these infections that can affect his asthma and affect his lung function. Okay. He seems to be doing fine. I'm going to go ahead and make sure that I'll script for 2 of the pumps and spacers are given to you. I prefer to use those. Maybe when he was little, he used the machine.
Yeah.
It was a little bit more difficult. All studies show that the machine and the pump with the spacer are equally as good. Sometimes even better with the spacer because you're getting all the medicine as opposed with the machine. I'm sure you remember a lot of that mist and medicine seeps out the sides. The kids are just moving their heads around. Okay. Is there any other questions you have for me?
No, not at the moment. Thank you.
No. Okay, excellent. So I'm going to ahead and provide you all that information.
Okay.
I'll give it to you in a folder along with the prescriptions, and you should be out of here in a bit.
Perfect. Thank you so much.
You're welcome. All right, Johnny, it was nice seeing you.